You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, fast braces. With us, we have an expert on the topic, Dr. Anna Smith. Dr. Smith, welcome to the program.
Thank you, Randy.
So, fast braces, that's and you brought some photos. Yes. Pretty big, very popular procedure in your practice.
It really is. I've been doing orthodontics now for about 8 years, and since we've started doing fast braces the last couple of years, it has just exploded in our practice, so much that we've had to add new operatories to new rooms to our building.
Really?
Yeah, people love this.
All right. Now, before we get into today's topic, for people that don't know you, tell me a little bit about your practice, who's a typical patient, and what are the different procedures that you do?
Sure. My practice is a general dentistry practice, so the question of a typical patient is kind of a trick question. I don't have a typical patient. I see everybody. And so our practice starts with young children coming in, ages 3, 4, 5 for their first exams, okay. And then we have teenagers getting their fast braces or other types of braces. We have the whole family coming in, moms and dads coming to get their general dentistry, their root canals, their fillings, their extractions, things like that. And then we have patients coming in for their implants as they get older.
Dental implants.
Dental implants, yeah. And then as they get older, dentures, partials, things like that. So I even have patients who come to me not for dentistry. They come just to get their sleep appliances. They hate their CPAPs and they want to do something different. So
yeah, we're going to have you on the show also to talk about sleep apnea, which is a big part of your practice as well.
Yeah.
Interesting. And you also do these crowns in a day. I guess you have like a mini lab right there.
We do.
Tell me about that.
Most crowns take about 3 weeks to make. In my office, we can make them in about 15 minutes. And so you come in, even if you need a root canal the same day, which many people do, we can do your root canal, get your crown on one day, 2 to 3 hours, you're done. You don't have to come back.
Now a lot of people know you. I guess you're on billboards, a lot of advertising that way.
Right. Yeah, our office draws from lots of the St. Louis area. So we don't just have patients just from our little area. Because we do so many services and we have so much to offer, we have patients who travel for hours to come to see us.
Are people still afraid of the dentist, by the way? I mean, do you hear it all the time?
Yeah, absolutely. No. Every day, patients say, oh, I hate the dentist. I hate coming
How do they
here.
say it to you, by the way?
I hate the dentist.
They say that? I hate the dentist?
Yes.
No offense, I hate the dentist?
Right, sometimes, yeah.
And what do you say to that?
I just say we're different. You know, whenever you leave, you probably won't have that same opinion of us.
How important is the smile? Now, you're a dentist, of course. You probably think it's pretty important. How important is it?
Right. The smile is everything. It is the way that you show the world who you are. The smile is the most important thing. There's actually research, or there are studies that have been shown that a smile ranks up there always in the first 3 things that people look at whenever they interpret another person. The American Academy of Cosmetic Dentistry actually did a survey of just general people, not dentists, just general people, and asked them, have you ever looked at someone's smile to evaluate their education level or their economic status?
Interesting.
75% of people said yes. These are just general people. We know we do this. It's how we look at other people. And then the thing...
Good point.
Yeah. And one of the great things about helping, especially young kids and fast braces and helping their smile when they're young, is that there's actually research that shows that with children, it helps their personalities develop. So if you can
having straight teeth,
by having a great smile, by being able to present yourself in a good light, then people will see you the way you want to see you, and your personality develops in a better way. So it takes away some of those really awkward circumstances for you.
What about in this economy? You know, why invest in your smile?
Well, again, if you're trying to get a job, if I interview people, you know, I have people who come to me for a job, and if I'm interviewing 2 people, twins, say they're twins, one of them smiles in the interview, the other one doesn't, who am I going to hire?
That's a good point.
Everybody wants the person who smiles, who's confident enough to portray themselves with a great smile.
Now, fast braces. Okay, moving on to today's topic. Now, is this fairly new? This fast braces concept where you can, I mean, some of the photos, and we talked in my green room, 3 months.
Right.
Straight teeth.
Right. It's amazing. The technology's actually been out there for about 20 years, so it's not new. It's been tested and proven. It's safe. It works. In our area, it's actually been available for about 2 years now. I was the first dentist in the whole St. Louis area to offer this to our patients, and we've had great results for 2 years now.
How is it different than traditional orthodontics?
I
mean, why is it so fast? And when we're talking fast, how fast?
3 months to a year is typical for a fast braces case. And those are for patients who have been told it's going to take 2 to 4 years with regular braces. So now we're saying 3 months to a year.
Why?
The technology. The technology is different. It's just a different set of principles that we work around. And I can bore you with all the physics of it if you want. But really the main thing is that we're moving teeth with steady, gentle forces. And research has actually shown that these fast braces have less sensitivity than regular braces, even though they're working faster.
What do you mean less sensitivity?
Your teeth hurt less than with regular braces.
Is it the brackets? I mean, the wires, like those steel wires.
Right.
Is it stronger? Is it different? Is it better?
It's different. So it's not steel. It's a different type of metal. It heats up with your body temperature. So you're slowly and gently applying these forces over a longer period of time. But it's not harsh. We're not tightening anything. We're not cranking anything to move teeth. We're letting the wire and we're letting the technology do the work for us.
Are you only addressing the teeth that show in the smile? Is that another reason why it's fast?
No, we're doing everything. And so you're getting with fast braces what you will get with regular orthodontics. It's just faster with less sensitivity.
What could an orthodontist argue about this? Would they be skeptical?
Absolutely. And that was one thing I was
Are there orthodontists doing this technology, this technique?
The inventor of this is an orthodontist. It was invented by an orthodontist. And I was extremely skeptical of it whenever I started. One of the reasons was because I had been told that if you move teeth so quickly that they're going to fall out or that it's going to hurt a lot. And what we found with this technology is that it doesn't.
So what are the age ranges of people doing this? Just for kids?
It's not. Fast braces are for anyone. And so we start with kids. Obviously, we can start with whoever would get normal braces can have fast braces. Typically, we start evaluating children around the ages of 7, 8 years old. Sometimes I can actually help prevent children from needing braces if I can get to them early enough, if parents bring them in early enough. But then once they're ready for braces, usually around age 11, 10, 11 is where we start.
What is that, 6th, 7th grade?
5th, 6th grade. That's about the right age. And then I've had patients up into their 60s. They get fast braces.
60-year-olds are getting...
They are.
I mean, that's young. I'm just saying, though, that the 60-year-olds are getting braces.
Yeah, and normally when they come in, they're telling me they're too old for braces. They don't know what their options are, but can I please just give them whatever I thought I would do for my mom or my dad, whatever I think I could offer them, go over their options with them. And they're so surprised to learn that braces are an option because they've been told that they're not.
Now, you do the other things. You do Invisalign, and you do some of these other technologies, 6-month smiles, things like that. Mm-hmm. You seem to lean toward this, and I don't want to put words in your mouth, but you like this. Why?
I like this because my patients like this. I've learned to like this over the last 2 years because my patients lean towards this. And so I started with traditional braces and Invisalign, Clear Correct, 6-month smile. I've done all of those. And what's happened in the last 2 years is patients learn about this and they don't want the other stuff.
So can you get the same results? I mean, the main thing is it's straightening teeth, right?
Mm-hmm. Right.
Is it less expensive than those other we've mentioned?
It is. It costs less than the clear braces. It costs less than the traditional braces. And it also works faster. We've talked about that. One of the things
the magic is in the wires, and I'm sorry to interrupt.
It's in the technology of it. It's just a different principle altogether. The other thing that really I think pushes people over the edge about fast braces is that it comes with a lifetime guarantee. And so most people, especially adults, at some point they've had braces, their teeth go crooked again.
Happened to me.
Yeah, and they have to pay for braces again if you want to straighten it. Or you do something else. You get veneers, you spend $10,000, $20,000 to straighten your teeth a different way. Well, with the fast braces, if you lose your retainers, if the dog eats your retainers, you can get braces again, no charge.
Is that right?
Yeah, you just buy the new retainers. And it doesn't even have to be with the same...
So it's like a braces for life.
Yeah.
So somebody goes in, and so these are around the country?
The whole world.
Okay. And so 10 years lapses, 20 years your teeth shift and get crooked. You go in and they fix them again.
No cost.
Interesting. Very interesting.
It's really the only system of braces that I've ever come across that offers that.
Now, it's less expensive than Invisalign and a lot less expensive than porcelain veneers.
Yes.
Obviously, probably 80-90% less.
Exactly.
And you also do something that's unique as far as financing. And I'm not trying to, by the way, side with you here. Okay. People need to know this is a real interview. Nobody's reading cue cards or anything, but you finance.
Yeah.
You'll carry it.
We do.
Is that right?
We do, yeah. There are lots of times people will come in and they know what they cost and they're ready to do it. Other times people come in and they're just kind of getting information. They want to know because they're planning on it. And they're often surprised to learn that they can actually start with the money they've saved because we'll finance them for the rest of it. And so we do in-house financing. We also go through other services like Care Credit and Chase and some of those other ones as well.
Okay, so you brought patient pictures.
Yes.
All right. You know, it's nice. You smile as if like you're showing me baby pictures or something here.
Yeah, these are my friends.
So you're excited about this.
This is great. I love this. So this actually was the first fast braces case that I ever finished. So this is Lauren. She's a 16-year-old girl, beautiful girl, but there's some things about her smile that she just doesn't like. And she doesn't like how the teeth on the sides of her smile are very prominent. They really stick out further than the rest of her teeth. And so I want you to take a look at her profile picture. You're gonna notice. Just keep an eye on that. You're gonna see how that changes for the better.
Okay.
And then when I look at her smile, I see lots of things that she wasn't even aware of. I see how her bottom teeth are hidden behind her top teeth. You can't even see her bottom teeth. I wanted to give her a nice broad smile. So when
I look at this inside, boy, that's a graphic photo. But when I look at the inside of that photo, is that considered like an overbite kind of a situation going on?
Exactly. Her top teeth come well over her bottom teeth. You barely can even see her bottom teeth. And so those were things that we decided we were going to work on for Lauren with her fast braces. And so on her after pictures, if you take a look at those, first just look at her chin, look at her profile picture.
Oh my goodness.
That chin is in a different spot. Her whole face developed with these braces. Now, the reason for that is part of that amazing technology. The braces actually helped her develop. She was still in a growing state, which is great. That's when we want to see kids, is when they're still growing. And her chin, actually, her jaw helped develop and grow to the shape that it should be. It's no longer being held back in that position.
Is your goal, obviously for kids, I mean, parents are going to watch this for their kids. And I have a 10-year-old and a 20-year-old, but is the goal to get them early so they don't have to, I guess, do this in their high school years?
It really is.
Or is there a goal for you? How early? When should they do it?
I like to see them whenever they're about 8 or 9 years old. 7, 8, 9. Let's see them then, because sometimes we can actually prevent some of the big problems from occurring. If we get them young enough while they're still growing and developing, then they may only have to wear their braces for 6, 9 months. If we get them later, then they're probably going to have to wear them for about a year with the fast braces.
Okay.
So with Lauren, she was ecstatic. We got her braces off less than 8 months. Her dad actually drove her about 45 minutes to an hour each way to come see me because he wanted her to get her braces done before she got through high school.
Very nice.
Yeah, she was considering either going to medical school or Juilliard. He didn't want her to have to deal with that while she was away from home, so they got it done. Actually, her case only took 8 months. So this is another young guy. This is Caden, and he is in 5th or 6th grade.
Looks like a happy kid.
He is. He's a really great kid. Now, the things Caden didn't like about his smile is that he had crooked teeth, and he actually didn't have all of his teeth yet. So his mom was extremely proactive about bringing him in while he was young, and she brought him in at the perfect time. Which is whenever they don't have their teeth on each side on the top, when they haven't gotten those yet.
Interesting.
That's the perfect time to start braces.
Why is that?
Because they're still developing. We can actually help their mouth develop to create enough room so the teeth can come in straight. And so with Caden, we were able to do his braces in less than 1 year. Now, keep in mind, he's only in 5th or 6th grade. He got his braces done before he started 7th grade. He's done. He gets to go through junior high, high school. He doesn't have to be teased and have braces. He has a great smile, and he doesn't have to think about it.
Fast braces. Do they just ask for fast braces?
They do now, yeah.
Okay, and this after, so it's very nice.
Yeah.
So those teeth grew in?
They
or
did.
Did you wait for those teeth to grow in to get the braces?
They come in naturally, and we created enough room for them to come in straight. So this is really the type of patient we like to see more of. We like to see the parents who bring them in, sometimes even before the parents think they're ready, just to get information, just to learn about it. And then they're surprised to learn we can start now and get them done.
Because the kids probably aren't big fans of getting this done.
Right. You know, kids tell me every day, though.
It's nice to get it done before high school.
Right. That's what they tell me. And kids, they may not confide in their parents that they want braces, but when I ask, they'll say, yeah, I don't like that my teeth are crooked. Or,
really?
I don't, my friends have braces. I'm ready to get my braces. So we don't put them on too early because then they have to wear them longer than they need to. But we'll put them on as soon as they're ready to get that phase of their life done so they have a great smile.
Okay, good. What else do you have there?
This is Kayla. Kayla is a freshman in high school, a cheerleader, and she just really had crooked teeth. That was her main concern. She had top teeth that were behind their bottom teeth.
Wow. Is that unusual to see that?
It's really not unusual. What happens is patients like this, they just learn not to smile. They learn how to use their lips to cover up their smile because they don't want people to see that.
All right.
And so whenever they come in, sometimes they're so conscious of us pulling their lips back and taking their smile that they're shocked by the way that looks on the camera. And
so when you see this, when you see a girl like this,
yeah.
do you say, boy, this is going to be good?
Yeah, I know it's going to be good before we start. I light up, and sometimes my assistants and I were telling the patient we're so excited when we start because we can see the end. We know what they're going to look like in a year. We know where we're going, and it's exciting to us.
Do they end up getting compliments on their smile?
Oh, yeah. All the time.
Now, by the way, with your teeth, I've had dentists on the program before. We'll put you in first place as best smile for any dentist we've ever on the show. Did you have braces?
I did, yes.
You did? Okay, good. But fast braces was not an option.
It wasn't an option whenever I had them in 7th grade.
Oh, 7th grade. Okay. So with this girl, so she had them. How long did it take?
For Kayla, it took about 13 months to get her from beginning to end.
So a school year.
Yeah, about 1 school year. And she did it when she was a freshman, so she was excited. She wasn't going to have to deal with these through prom and graduation and senior pictures. That was one of the things she was so excited about, was that she got to get these done early. Her after picture, take a look at that. That's amazing.
Very nice.
She has perfect teeth now, and she's proud of them. So we'll keep going through some of these cases, but I just want to let you know we do adults too. It's very common, and I thought when we started braces I would be doing mainly teenagers. I thought that's who got braces. With fast braces, we find that we have as many, if not more, adult patients because they want to spend
less. Like the 40-plus crowd?
Yeah, they want to spend less money, and they don't want it to take as long. They want to get the braces on and off, and they don't want to come to the office for 2 to 4 years. They want to get it done in 1 year.
Okay.
So this is Billy. Billy was actually so self-conscious of his smile that he wouldn't smile when we asked him to at the beginning. And so when we took his pictures, his front teeth actually set out. They were jutted out, and he was extremely self-conscious. Now Billy wants to be a meteorologist. He wants to be on TV. He wants to show his smile to the world, and he knew this was holding him back. And so I let Billy know we're gonna get those teeth straight so you can smile and show the world who you are. And he was ecstatic. He actually told one of his friends to come in. I'll show you her pictures in a minute. But Billy in about...
Go to my dentist, he says.
He did.
Is that right?
Before he was done.
Referrals from kids.
Right. And he had only had his braces on for 3 or 4 months and already seen such a huge improvement in his smile. He had his friends coming in to get theirs.
I always wonder what kids are talking about when they're by themselves. And now I know. Right. Go see Dr. Smith. She's great.
That's one thing.
Okay.
So in about 13 months, this is Billy's after. You can see how his teeth are straight up and down. They look perfect. He's ready to be on TV now.
Very nice. Very nice.
Now this is his friend Ashley. She had always had a gap between her front teeth, and she disliked it.
It's a small gap, though.
It's small. It's not big, but to her it was huge, and she wanted it gone. And lots of people have a gap between their front teeth. Some people enjoy it. It's their trademark. They wouldn't want to get rid of it, and that's great. Other people hate it. They want it to go away. And if you want it gone, it can leave. You don't have to have a gap unless you want to.
One of my assistant producers, I introduced you to her, and the local dentist said, "You're fine. It's not." What are your thoughts on that? Because I guess you differ.
Right.
From that philosophy.
It's not my gap. It's not my teeth. So in my practice, we typically let people know their options. If you want to get braces to close that gap, you can. If you don't, if it's your trademark, you can keep it.
And how long does that take, by the way? Because she has a very pretty smile, obviously, in the after.
She does. Everybody's different. For her, it took about 10 months. Other people, we can close gaps in 4 to 6 months.
Are there other options as well? I mean, you could do bonding or whatever.
Yeah, and that was an interesting thing with Ashley. One of the reasons she decided to come was she was considering other options, maybe some veneers. We actually thought we might have to do veneers along with the braces, but turns out the fast braces were enough for her.
Just bring them together.
Yeah.
Okay, so adults are doing. This is the new hot thing, the 30-plus crowd.
Yeah.
According to you, they're getting braces.
They are. And a lot of them they don't realize it's an option. Some of them have even been told, you can't do braces, you're too old, your teeth will not move. And they're surprised to learn that they actually can and that it works so quickly for them too. So here's some pictures. This is Cheryl. Now Cheryl had several things going on. Her teeth on each side of her smile were poking out, and she didn't like that. She had some old fillings, dark colors on those as well. And so in just a few months with her too, you can see we completely... A few months. We completely rehauled her smile. 8 months later, she has perfectly straight teeth. Those old fillings are gone, and she's so happy with the way she looks now. She smiles more. She's just more outgoing.
Now, by the way, with these patients, like the adult patients that are doing this fast braces, do they come in from advertisements, or is this your general dentistry population?
It's everybody. So some of these patients I've seen for years, and they've just suddenly realized, oh, I can get my teeth straightened. Other people come just for the fast braces. We have patients who will drive 2 hours plus to come for their appointments.
Not a lot of people doing fast braces in your town?
There really aren't too many patients. We actually have patients driving from Iowa to come to us in Illinois, or the other side of Missouri to come to us, because there aren't too many fast braces.
So on the internet, if they do a Google, they'll find you?
Yeah, they will. We'll be right up there.
Okay, good. And so the patient, what's your oldest patient you've ever had that did fast braces?
Probably mid-60s. I have some pictures I'll show you of her too.
All right.
Okay. This is another patient. She had always been so incredibly self-conscious of her smile. And she didn't like her gap. She didn't like that her front teeth set out further than her other teeth. And she would tell you that it was holding her back. She did not like her smile. And so she asked if we could do the braces. We said yes, that would be an option for her. 6 months later, in just 6 months, I mean, that's the amount of time between your teeth cleanings. Imagine you come in with crooked teeth, and then 6 months later you're back for your appointment. And she was ecstatic. She actually said she started working out, losing weight. She would say she was a more outgoing person because she would approach people now. She wouldn't before because she had a great smile. It was holding her back, and now she can do what she wants to do.
So if you don't like your smile, I mean, you feel like, look, if you don't like your smile, do something about it.
Change it.
And don't let money get in the way either, because you do
not.
finance them.
We do.
And if they have a credit issue, you will also work with them.
Yeah, we do.
You'll carry it yourself.
We work with people all the time to do internal financing as well through other companies.
Okay. And now, by the way, when they call, how soon from day one do they find out if they're candidates?
Every situation's different. A lot of times it depends on their schedule, but we actually keep openings in our schedule every week. So if you call, there will be an opening. We will be able to offer you an opening that same week.
So they'll fit you in?
Yeah.
Okay. And can you, like, if they go, can they start that day?
Yes.
Do you ever start people on the same day?
Almost all the time. And because so many of these people come from far away, or they're so they consider their time so valuable and important, they want to do it now. They don't want to waste an appointment and come back later.
I have a friend, 43 years old. She just got braces. I haven't seen her for a while. I saw her. It makes people look younger.
It does.
I think when adults wear braces,
it's true. A lot of them
are,
they're scared that they're going to look like, they're going to look older or look on the opposite end like adolescents. You don't. You just look like you just look like an adult who's trying to straighten your teeth.
But because isn't it true though, if you're an adult, it's going to take you longer? It's harder to move those teeth? Or is that not true?
It's really not true. Sometimes it takes longer, but it's not because the teeth are harder to move.
Okay. Now I interrupted you with this one right here. Is that the same patient? No, that's a different patient.
This is a different one. This is Carolyn. And Carolyn, she had noticed that her teeth kept getting more crooked the older she got. So when you're an adult, as you age, you actually show more of your lower teeth than your top teeth. So Carolyn was in her 60s, and she had noticed that more of her bottom teeth were showing, and they were starting to buckle on top of one another. She had actually been told that braces was not an option for her. She shouldn't do it. She was too old.
Another dentist told her that? Too old. Okay.
So she was considering having some of these teeth removed and having a permanent bridge placed. She was going to have teeth extracted and have a bridge placed and pay about 4 or 5 times as much money as with fast braces.
How'd she hear about you?
She heard about me on TV.
That's right. You're on TV, right? Aren't you in St. Louis or something?
Right.
You're on TV?
We do. Every month we do a couple shows in St. Louis on some of the local TV shows.
And they're live. They're live
they
TV.
Are. Yeah.
I could see why they would invite you back, by the way.
Thanks.
Because you are enthusiastic about this.
This is
you get people excited.
Yeah.
Going into this, I'm thinking, oh boy, we're talking about fast braces today. This is, but I think you've made it exciting because you like it. You see transformations in your practice.
Right.
Like I say, and I'm not trying to downplay this, but I think of it as just straightening teeth. But you see changes in personality.
Right.
Changes in self-esteem. Elaborate on that.
Right. It goes so far beyond a person's teeth. That's just the thing we put the braces on. But what it does is it changes the person. And so it changes their self-image. It's not about their teeth. And whenever you change a person's self-image, then they think of themselves in a better light. They're going to be more approachable to other people.
Well, when you see somebody smiling, you definitely
you notice.
Treat them differently than somebody that's not smiling.
You do.
Whether it's a waiter or, whatever.
Right.
Okay.
Yeah. It makes all the difference.
So how long? So she went from these crooked teeth to these perfectly straight lower teeth in how long?
3 months.
3 months.
3 months, that's it. In fact, she said that some of her friends didn't see her in that amount of 3 months. And when they finally saw her again, they didn't know what happened. They thought that was impossible. How could she get her teeth straightened in just 3 months? They thought they weren't her teeth.
Dr. Smith.
Fast braces.
Is that right? So that, or are there other dentists who would be skeptical that you could do it in 3 months?
Yes.
That fast?
Yes.
Safely?
Yes. I was skeptical before I started doing it. It seems like it's not possible, but it's because of the different technology. It's just updated technology.
It's all in the secret, I'm calling them special wires. Is that right?
Yeah. Here's a great analogy, and I've used this before to explain how fast braces work. It's kind of like if I wanted to travel to California. I could fly in a plane. It might take 3-4 hours, or I could drive in a car. It would take me 2 or 3 days. If I drive in a car, it's not going to hurt more. If I fly in an airplane, neither one hurts more. It's just different technology. You still get there. One costs more than the other. You still get there. It's just a different amount of time and the cost. That's all that's different.
And so this one, so it works. It straightens teeth.
It does.
And it's in, would you say, half the time of traditional braces?
Typically about half the time.
Half the time. Yeah. And would you say that more and more, are the patients getting older and older that are getting braces these days?
I'm surprised, yeah, because as patients start hearing about this, as people start hearing about that, then the people that were considering spending $10,000 or $20,000 on veneers are now coming in and saying, hey, can I just get my teeth straightened for a quarter of that cost? Save some time and money.
Is there a certain kind of a patient, we're just about out of time, but that you'd like to see more of with this fast braces?
Sure. Anybody who doesn't like their smile. So somebody who comes in, they want to have a better smile. They want to have a smile to show off to the world. That's who I want to help because they're excited. When they start seeing the changes happening, they excite us and we excite them.
Do they ever want to give you a hug and they say, oh, Dr. Smith, this is great?
They do. They hug us all the time. Yeah, because we're changing their self-image.
That day when they get the braces off.
Yes.
Is it emotional for some people when they look in the mirror?
Yeah. I would say half of these people either cry or they just need a minute when they finally see their self without the braces. Because it's not their teeth, Randy. It's their life. It's their self-image. This has impacted them for the rest of their life. They're going to be happier with who they are.
So it's called fast braces. And for people just tuning in, we're talking to Dr. Smith. And but you do more than just braces.
Yes.
I mean, you do crowns. I mean, you do fillings. I mean, you're a general dentistry practice. You do dental implants, veneers.
Right. One of the great things with patients who have fast braces is that we can clean their teeth when they come in for their appointments. If we find they have some fillings, we can do those at the same time they come in for their appointments for their braces. So we can do everything at once. They don't just have to come to us for one thing. We can take care of them for everything.
What about pain?
With fast braces?
Yes.
Less sensitivity than regular braces. So pain really isn't a factor with the fast braces.
Like the older patient. And I got to show this lady one more time. Okay, so she had really crooked teeth, and you went to straight teeth in 3 months.
Yes.
Does she complain about pain?
She said that they were sensitive whenever she had the braces on. But as far as I know, she never even had to take any ibuprofen or medicine. It was just sensitivity. It was totally worth it for her. It changed her life.
So final message, somebody watching this, they have crooked teeth.
Yes. Call me. We can change it. Yes.
All right. Free consultation?
Yes.
Put you on the spot?
Yes.
Okay, good. Thanks for coming on the show.
Thank you, Randy.
Very good. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this program again online, go on to wellnesshour.com, put in fast braces. And for those of you on Twitter, you could put # Wellness Hour and make a comment about Dr. Smith. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.